Hi, I'm Kayla Stone, an epidemiologist with the Waco-McLennan County Public Health District, and I want to share some information about Ebola with you. Ebola was first identified in 1976, so we've known about Ebola for several decades. There's been 24 outbreaks to date in Africa of different sizes, small, some larger. Some of the notable ones, in 2007, there was over 250 cases in the DRC, or the Democratic Republic of Congo. In 2000, Uganda saw an outbreak of over 400 cases. In 1995, Democratic Republic of Congo saw over 300 cases. So there have been outbreaks of Ebola over the last few decades, and they have been contained. The virus hasn't changed, and we know as much as we did then as we do now, and we know how to stop it. The most recent outbreak in West Africa started earlier this year in March. The countries that are affected right now are Sierra Leone, Guinea, and Liberia. Senegal and Nigeria both saw cases, but there is no active transmission in these countries at the time. The Democratic Republic of Congo is seeing several cases at this point, but they are not associated with the West African outbreak. Currently, there are over 8,500 cases in West Africa and over 4,000 deaths reported. Here's a picture showing where these countries in West Africa are, where the active transmission is taking place. Just north of the map, Senegal, there's the edge of Senegal, and that's where there's no active transmission. If you were to go off the map to the right, that's where Nigeria is, and there's also not any active transmission there at this point. And the DRC is in the middle of Africa, and there's some cases there, but it is not associated with the West African outbreak. Here's a timeline of how Ebola has come to America. In early August, on August 2nd and on August 5th, the first U.S. citizens to come down with Ebola were transferred to the United States, to Emory Hospital. On September 5th, another U.S. health worker was transferred to Nebraska Medical Center. Several days later, another U.S. healthcare worker who worked with the World Health Organization was admitted to Emory University for Ebola. We don't know much information about this patient, but we do know that there was another patient admitted on September 9th. September 20th, 2014, Mr. Duncan arrived in the U.S. from Liberia. Later that week, Mr. Duncan went to the hospital in Dallas, but was sent home later that day. 2 days later, he was isolated because he was suspected to have Ebola, and it was confirmed the next day, September 29th, that he did indeed have Ebola. On October 6th, a U.S. NBC reporter was transferred to Nebraska Medical Center. A couple of days later is when Mr. Duncan died. October 12th, the first healthcare worker who was a part of the treatment process for Mr. Duncan tested positive. A few days later, on October 15th, the second healthcare worker who was treating Mr. Duncan tested positive for Ebola. What is Ebola? We know that it's a viral hemorrhagic fever, and there are several strains of this virus. 4 of these viruses can affect humans, and the 5th one only affects animals. The current strain of this virus that is affecting West Africa and those patients that were in America is the Zaire strand. This is the most common strand. Ebola is characterized by fever, loss of fluids, and unexplained bleeding, which can lead to organ dysfunction and shock. This virus attacks the liver. It can cause disseminated intravascular coagulation, or DIC, and it attacks certain parts of the bone marrow, which can hurt the body's ability to recover and react to this disease. How is Ebola transmitted? Well, it's transmitted through direct contact with blood or body fluids. These body fluids could be feces, saliva, urine, vomit, semen, sweat of an infected person with Ebola. So you have to come in contact with somebody that is sick with Ebola and their body fluids. This body fluid can contaminate inanimate objects and can present exposure through touching these objects that have had the body fluid on them. An example of this would be being stuck with a needle that has Ebola on it. The virus has to come in contact with broken skin or unprotected mucous membranes. These mucous membranes could be cells and tissues around your eyes, nose, mouth, or any of your orifices. To recap, you can't get Ebola through the air, you can't get it through water, you can't get it through food. You have to have contact with body fluid from somebody that is sick with Ebola. Ebola only spreads when people are sick. A patient must have symptoms to spread the disease to others. This disease has an incubation period, or a time that the virus is in the body, and it has time to grow to develop into Ebola, 21 days. If a patient does not have any signs and symptoms for these 21 days, they do not have Ebola, therefore they cannot spread the disease. Some of the signs and symptoms of Ebola include fever, headache, diarrhea, vomiting, stomach pain, unexplained bleeding or bruising. And as I said, the incubation period for Ebola is 2 to 21 days. Typically, you will see this incubation period between 8 to 10 days. To diagnose Ebola, a patient has to have several things. Has to show signs and symptoms, most notably fever, and has a travel history to West Africa, which includes Sierra Leone, Guinea, Liberia, or the Democratic Republic of Congo, or exposure to somebody who has Ebola in the past 21 days. If somebody has signs and symptoms and travel history or known exposure, then the patient is isolated and the Waco-McLennan County Public Health District is notified immediately. And we will work with the state testing lab to go about testing for Ebola. Once there is a suspect case of Ebola and samples have been sent to the central office in Austin, the health department will initiate contact tracing immediately. Contact tracing is a big term for investigation. The health district staff initiates contact tracing by investigating and questioning the person who is suspect to have Ebola, finding out who possibly could have been exposed in that small window of time when they started showing symptoms. We will follow these potential exposures for 21 days, monitoring their temperature and signs and symptoms to see if Ebola develops. Once the 21-day period is over and no new cases have been presented, the cycle is over and the outbreak is contained. If someone under investigation in these 21 days shows signs and symptoms and is tested positive for Ebola, the cycle will start over again, and we will continue to monitor those potential exposures for another 21 days until there is no more spread. There are different levels of risk of exposure to Ebola. Several things to keep in mind. If there is no travel history to West Africa within the past 21 days, if there's no contact with body fluid of a sick person with Ebola, and if there's no contact with animals from West Africa, then there is zero risk in getting Ebola. To have low risk, you may have traveled to West Africa but were not exposed to anyone that was sick or any animals. To be considered medium risk, this would be somebody who is involved in Ebola patient care or lab work and used proper personal protective equipment. Maybe somebody that's in a house with a suspected case of Ebola but no contact. This is somebody that's showing signs and symptoms but is not yet confirmed to have Ebola. Direct, unprotected contact with animals from West Africa, these are known to be medium risk of exposure. To be considered at high risk of exposure, there would be direct contact with an Ebola patient or a suspected case, or work in a laboratory testing Ebola samples and not wearing proper PPE. Someone that participates in funeral or burial services or contact human remains of the suspected Ebola victim would also be considered high risk. Thank you for watching. I hope that information was helpful. If you have any more questions about Ebola or other infectious diseases, please visit our website.